So at Naz Wellness, we service about 400 patients a day with our home monitoring program. And it is the first home monitoring program to be created in the Lower Mainland. So what that consists of is pharmacists collaborating closely with nurses on a day-to-day basis. Nurses go to patients' houses and they daily dispense medications, sometimes witness them. They also do other interventions such as insulin injections. They do weight monitoring of patients, blood pressure monitoring as well. And then they write reports, which we read every day and communicate it with their healthcare team. As part of the patient population, it includes patients that have disabilities and are unable to take medications on their own. Patients with complex medication regimens that have trouble adhering to these regimens. And us as a pharmacy team and nurses get to help them with that. It also includes patients that have mental health conditions or that have been recently hospitalized with stroke or heart attacks, and we get to help them every day. So it is quite a fulfilling journey that we get to share with patients. When patients get started on clozapine, they need to monitor every single week what their white blood cells and neutrophil count will be. So in my role as a pharmacist, when I see that it's been over 1 week that the patient hasn't gotten blood tests done, we call them to make sure that they can go get the test done. It sounds easy, but oftentimes we don't find them in their houses, or there are challenges that prevent them from going to get the test done. So patients are less willing to get this test done. And when this happens, we tend to get reminders from companies that, the patient needs to get the blood test done and needs to be compliant, or else we're unsure if this medication is going to be safe for them. So this becomes a big time constraint on us as a pharmacy, on physicians as well, and we don't want to dispense a medication that's unsafe for the patient. So I think having a point of care testing removes all the barriers that I can think of, and they are able to immediately get the test done. Everyone's happy. It's done in a very timely manner. If it needs to be done every week, we're going to do it every week, and we're going to get those results and then modify the dosage, the therapy to just make sure that our patients are safe. So I think it's been quite an innovative experience for everyone, and it's very beneficial. We see that every day.
One of the things that I do as an LPN and going to patients' homes is I witness their medications. I do injections. I do, whether they're weekly, monthly, daily injections, usually insulin or antipsychotics. I monitor their blood pressure and their pulse. I do check their weight and assess that the care plan is being followed. And another one of my duties is to do point of care blood work with patients who are on clozapine. I've seen patients who, when I'm able to do their blood work, we actually get quite excited. We get the green light on their blood work, and we get excited, and then it's like, yay, okay, good, we're good for another week, and then we go on, right? And it's nice to be able to get the results right away, to be able to tell that to our patient, because it's one less worry for them, and less stress that they don't have to worry about. I think this really gives them options and gives them autonomy and lets them take care of their own health. This helps them do that instead of relying on other members of the community or their family. It can be pretty stressful to have to go every week to go get blood work done and to rely on a family member to have to take you there, or on themselves when they may think that they can't do that. For me to be able to go to them, it takes away this. It just becomes this normalized thing that we do every week, or once, or every 2 weeks, or once a month. And it becomes something that's, it's definitely something that builds trust between us, between myself and my patient. It definitely helps them on their journey to wellness. I also find that it gives them hope that they can do something different in their lives and not have to just focus on their mental health. On the care plan, it was actually written on there, this patient is known to be aggressive, and to be cautious about that. In the 8 months that I've been seeing this patient, not once has that been an issue. She has been amazing. This patient has learned how to have hope for her future, and talked about wanting to, to travel more, to be able to go back to work and start her own business. And she was talking about getting a grant from that was available for people who are in the downtown east side in Vancouver here, and to be able to start her own business. It's given her a lot of hope for her future. This is a patient who had difficulty functioning just by even paying her rent and living in unfortunate conditions that were not always healthy, and in an environment that wasn't always healthy. Her focus on her life has totally changed, and it's been a pleasure to watch. It's been amazing to watch her on this journey, and I'm going to cry here a little bit, and to be a part of that, and to be able to take away that barrier, that little bit of difficulty for her, and allowing her to find her way in her life now, and not have to worry about something that, somebody else may think, hey, it's not a big deal, so I have to get blood work every week, which could have become an insurmountable barrier for her. Sorry, I'm just having little tears. So with the families and caregivers, there's a lot of pressure when you have a family member that needs monitoring a lot, and sometimes it can be even a point of contention at times too, right? Because it can be quite stressful for a family when you have to take a patient in every week to do their blood work, and families have jobs, they have, other things to take care of, they have themselves. This takes that away, and it allows the family to be a family, and to develop their relationships, and not have to worry about this one, like some extra stresses on them. So that's one less thing that a family would have to worry about, and it gives that patient more autonomy for themselves, and for taking care of their own health. And just to, and we're just a little part of that assistance with that.